And it always takes a second. It says like preparing to live stream. I just wait till it's like almost all the way through.
Okay.
There we go. Okay, you're good.
All right, great. Good afternoon, everyone, and thank you for coming to the Insurance Subcommittee of the Health Committee of the Maryland House of Delegates. We have 3 bills on our agenda today, and I think a lot of work has been done on them prior to us coming into the subcommittee, so we should be able to move pretty efficiently. Again, I would like for members of the subcommittee to have time for lunch. So unless you have something really compelling that you absolutely need to say, please measure the time or watch the time as we do this. So we're going to start with House Bill 1091, and then we're going to do 1093 and then 1367. So Lisa, what does 1091 do?
This bill expands provisions of law governing the assignment of benefits under certain health insurance policies to apply to dentists in addition to physicians. The bill also establishes parallel provisions governing assignment of benefits and non-preferred provider dentists for dental plan organizations. There were amendments that were distributed that make technical changes that were correcting some drafting errors.
Okay, I don't know if Delegate Kerr is here.
Move the technical amendments.
Okay, thank
Madam Chair.
you. Do I have a second on the technical amendments? Are these on the, you'll have a chance to say something before we.
It's on the amendments.
Vote on them, Dan. Yeah, we'll have a chance. Let me get a second on them first.
And I know I need to make one more technical amendment, Dan, if that's the.
Okay.
Okay, which one's that?
It was moving enrollees.
Okay. All right, so I have a motion and a second. Dan Doherty, would you like to tell us what we're missing?
Yeah, Lisa may be addressing it. It's on page 4 of the reprint, line 27. The language doesn't make sense. It seems to me it should read the amount that is the enrollee's responsibility.
Yes, that's what I accidentally, when you put it, you have to say the first the or the second the in amendment language, and I accidentally put the first the, so it did not make sense.
Okay, fine. That's all I have.
Delegate Kipke, are you okay if we just accept that as a friendly amendment?
I think that'll be all right.
Okay, so we have a motion and a second. Any discussion on the amendments? Seeing none, those in favor say aye.
Aye.
Any opposition? Seeing none, passes unanimously. Now on the bill as amended, do I have a motion?
Move the bill.
Second.
And discussion, questions on the bill as amended? Okay. All right, seeing none, those in favor of the bill as amended, please say aye.
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 Any opposition? And seeing none, bill passes unanimously. Thank you. So we're going to move to 1093, which is, I should know it actually.
That's the provider panels.
The health insurance provider panels. Lisa, tell us where it is now.
So this bill alters the process through which healthcare providers apply to participate on a carrier's provider panel. The bill repeals authorization for a carrier to charge an application fee, alters requirements relating to updating information in a provider directory, and alters requirements for a multi-carrier common online provider directory information system. There are amendments that are distributed that alter the timeframes for notice required throughout the application process to participate on a carrier's provider panel. When we discussed this on Friday, we had switched one of those numbers. We are now switching all 3 of at the different points in the process. And it strikes the penalties established by the bill for carriers that fail to meet the timeframe requirements. We are retaining current law for the types of providers a carrier is prohibited from limiting on a provider panel. And we are altering requirements for the provider credentialing application system in the multi-carrier common online provider directory information system by striking the requirement that the systems be developed by a nonprofit alliance of health plans and trade associations, and then by moving a few of the requirements, including the work group and reporting requirements from under the multi-carrier common online provider directory information system to under the provider credentialing application system, and changes the effective date to January 1st, 2027.
Wait a minute. Okay. First of all, Lisa, thank you very much for going through it and all the work that you've done on it in the last 48 hours. I also want to thank the carriers and the advocates for all the work that they've done on this in the last 48 hours. So, do I have a motion on the amendments, for all the amendments? And Delegate Kipke.
I'm sorry, having not attended law school. My good friend Lisa, can you tell me in plain English what this bill now does, practically speaking?
What it,
Somebody else, yeah.
right. Am I
You're on.
frozen? Okay. I can tell you. All right. So basically what it's doing is it's creating a uniform application form for providers who want to be credentialed by commercial carriers and MCOs. And it's setting timelines by which the carriers and MCOs must respond to the application. And that's, I mean, that's the meat of it. And you know, just setting out the rules and regulations for, not rules and regulations, but sort of the policy around how these things all happen together, and that it's online, and that there's and that yeah, that's basically it. Oh, yeah, and there was a question at one point about what why we had the Tort Claims Act in there, and the answer is because folks who are working in FQHCs fall under federal court claims in terms of liability. So that's why that's included there.
Thank you.
Okay. Matt, Delegate Morgan.
I was trying to put my hand down. I wanted to hear what Kim and Robin had to say first.
Okay. So Kim, your hand's up. I see your hand first.
I didn't intend to raise my hand. I don't even know what I bumped to do that. I didn't have anything to add unless there was a question for me, Madam Chair.
You were just too surprised that we got to this place, right? Robin Elliott.
Okay. Good afternoon, Robin Elliott with the Federally Qualified Health Center Group. I just noticed an issue that Mike Johansson had raised and that Dana Kaufman and I had discussed. He had picked up an inconsistency, and I'm just realizing it's not in the reprint.
Okay.
And so I just wanted to bring that to the committee's attention and the sponsor's attention.
Okay, so can you be more specific about the inconsistency of the work
Yes.
group?
I can be very on page 6 of the reprint.
Okay.
There is a description of that the carrier shall provide a 10-day notice of a complete application. This made sense when it was purely a paper process, but because there's another section of the law in which there is a 15-day notice of an application is complete and is moving forward, this is a little bit duplicative for both the carrier and the provider.
Yeah.
So So we would, I think Mike picked it up, um, suggest removing, it would be the line 6 through 13, but then to keep lines 22 to 25, if there's an incomplete application, the carrier would still be required to notify. There'll be very few of those because 99.9% are going to be submitted electronically. And I don't
So-
see Mike here, so I don't know if.
Yeah. Yeah, he had, I see now, because I thought we had talked about that, but that's, again, we've gone through this bill a lot.
Yes.
I am comfortable with that. Does anybody have an issue with, if looking at page 6, it's lines 6 through 13 that would be eliminated. 14 through 21 are already eliminated. And so we begin at line 22 on that page. Any concerns with that? And then I will move that. Can I have a second?
Second.
Second.
Okay, any discussion on that? Those in favor say aye.
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 Any opposed? No, okay, so we've done that change. Now we have the bill that's been amended in 2 ways. Can I have a motion on the bill as amended?
Move the bill.
Okay, second?
Second.
Okay, and any further discussion on the bill? Oh, I've got Delegate Morgan.
Thank you, Madam Chair. So what, in your opinion, I know we made a lot of amendments. What happens to the fiscal note? These amendments.
We
think
took the things out that cost money.
Okay.
Yeah,
I'm
I
making
mean,
sure.
yeah, we did that. It was the the part that the study that the commissioner had to do.
We'll be asking MIA for a letter before
Yeah.
this
Okay,
gets
sounds
the
good.
floor, if
Yeah.
nothing, if not before that. Yeah.
Okay, thanks, Lisa. Thank you, Madam Chair.
And Joe Wynn.
Madam Chair, everybody, it's Joe in with the MCOs. It might be too late, but I'm sharing a note that we talked about at the MCO level and relates to the additional 60 days, and we're glad that the subcommittees agreed to that amendment. Most of these credentialing reviews go by without a hitch, right? There's usually not a problem, but the 2 to 1% where there are problems require additional time. In some cases, a much more additional time if there is an issue with the provider. And these issues could be things like malpractice or substance abuse or DUI or something on their record that requires some additional work. And West Virginia just passed their version of this with an additional 30-day review if needed for complicated cases. And I don't know exactly how to propose an amendment, but it would be at the provider's benefit to have that option. Because what would happen is if they couldn't complete it, if there was an issue, it would result in them not being credentialed and not being on the panel. So this is a very small subset of a problem. Forgive my coworker here in the background. Yeah, so I don't know if it's possible at this stage of the process, but I do think it would help in those rare instances where we have the need to do additional work. And it could be a note. I think the West Virginia bill requires notice to the regulator and to the provider, so they both know there's additional time being sought to clean up any remaining questions on the application.
I'm gonna look to Matt Celentano. If you have any thoughts on that?
I'm aware of the additional language that was proposed in West Virginia, and I think that the commercial carriers would be supportive of the MCOs.
Okay, Robin Elliott.
So we have some concerns that there could be some unintended consequences by adding a 30-day extension, and that they could potentially sort of be more than that tiny percentage of I think the people that Joe was referring to. and that there's a potential that it could be used as sort of an option to really extend a much bigger pool of credentialing applications. So we think it, and I will also say that for the credentialing managers, as you all are feeling with this 18-page bill, the credentialing process is very complicated. They spend a lot of time tracking. So to add sort of an additional, I guess, almost asterisks to the process might be very complicated to manage on the provider end.
Okay, I'm gonna look to Kim Robinson.
I was just going to say that we would support Mr. Wynn's amendment. I hear what Ms. Elliott is saying. I think the reason why we would support it is because otherwise it does leave us in a place of likely having to reject those providers outright, right? And not having the opportunity to cure effectively for them. And so I think particularly my MCO folks, but I'm sure my credentialing team generally would have considered this provider friendly because it continues to create paths for them to participate and not then have to go outside of the process to do the work to try to cure and not be rejected.
Okay, I have Delegate Kipke.
Thank you, Madam Chair. I'm wondering if somebody from, I can see both sides to this, at least both
Yeah.
arguments sound very reasonable to me. Because it requires notice to the MIA, I'm wondering if somebody from the MIA can provide any feedback as to, if it just becomes the default of an MCO to extend everything another 30 days, that's not good. So I'm wondering if the MIA with the notice would be able to shed any light on whether or not they have the ability to ensure that these extensions are in the interests of the providers that are applying, and not just, a default 60-day program.
Okay, I'm gonna take Dan Doherty, Matt Celentano, and then I'm gonna make a recommendation. Dan?
Thank you, Madam Chair. It would seem to me that if you run into a situation where they have to investigate something about the provider, be it a malpractice claim or whatever, and it's in the interest of the provider, why can't both sides just agree not to enforce that extension and agree to have it go forward? I don't think you need a provision in the law to have that kind of an agreement.
Okay. Matt Celentano.
Thank you, Madam Chair. So in the couple of moments I had to think about this, I looked up the West Virginia statute. I think it does benefit the provider, as Mr. Wynn had sort of had suggested. And in West Virginia, to make sure there are no unintended consequences and no shenanigans, their language reads that the provider credentialing within 60 calendar days of receipt of a clean and complete application. I think that is pretty clean and complete. And it does allow for those really small amount of circumstances that are sort of outside the framework of what we're talking about here. But clean and complete, there's another level of review that needs to be taken, will happen, but the vast majority will fall within the 60 days that you guys are going, it seems to be, are going to pass here shortly.
So is there a definition of clean? I know what complete means, but in this context, is there a definition of clean?
Not that I can see from the West Virginia language, but I think that we would be able to get the MIA to opine on that.
Okay. I'm trying to decide. I mean, we can, one of the things we can do is just work on, go with the bill now, but change it in the voting session. Or we can hold this for another subcommittee. And I'm reticent to put it off. But if I guarantee to the group that I will work on what I would consider some kind of trigger language that would, where something would have to be clear that the extension was needed before we automatically gave it to them. Dana Kaufman?
I'd like to actually see the Virginia language first. I don't want to insert clean though. We're trying to keep the statute as is. The statute has not had that term of clean. We don't know the definition of it, so I'm reluctant to do that. But I would like to see this bill move in subcommittee. And if we wanted to then take a look at the Virginia language in the meet between now and the vote session.
Which is likely either Thursday or Friday. We're not, we're working on that schedule. I'm gonna ask then if there is a motion on the bill as amended. Actually, we have a motion on the bill as amended. And if we go forward, I will call for the vote. If we pass this, I will make the promise that between now and the voting session, we will work on, whether that language should be incorporated into this. And I know, Melissa Speck, you've been very patient, so I'll go to you before I call for the vote.
Thank you, Madam Chair. I just wanted to ask whether or not in the reprint, I believe, at least the version I'm looking at, and this is not related to the clean claim conversation, but before you would vote, there was the addition of language around the vendor establishing a stakeholder work group, and it looks like moved up to the credentialing component, whereas previously it had addressed it in the directory, multi-carrier directory component. And I'm just curious as to how that came to be and whether or not that was potentially a drafting error.
No, actually, it was to respond to the notion that parts of the bill apply to MCOs and parts don't. So that's a part that doesn't apply to MCOs. So we put it in the part of the bill that doesn't apply to MCOs. So that's why it was moved. It still exists. It's just moved to a different location.
And so the intent behind the stakeholder group is to address the credentialing components with respect to the things. Okay.
Okay, I've got a motion and a second. Those in favor of the bill, please say aye.
Aye.
Those opposed to the bill, please raise your hands. Okay, we have unanimous with the promise of looking at the potential amendment for the voting session. Thank you all for giving me grace and indulgence on that. And so House Bill 1367, Commission on Reimagining Healthcare in Maryland, and I'll never hear the end of reimagining, but okay. Lisa, you want to talk real quickly about what it does?
The bill establishes a Commission on Reimagining Healthcare to envision a comprehensive healthcare system for the state. The commission must study numerous issues and make recommendations regarding the establishment of a new healthcare system. The Maryland Department of Health must provide staff for the commission, and the bill is contingent on MDH determining funding levels needed to conduct the work of the commission and to secure the private funding to do so. There are amendments that alter the preamble to include a reference to dental, vision, and hearing, and then the amendments also not in the preamble add a representative with expertise in the practice of advanced practice clinicians.
Okay. So quickly, I mean, she captured it well. This is really, as the result of the work that the Kerwin Commission did relative to education and sort of really looking at what the current state of education was in Maryland and making recommendations on how to improve it. We felt when we talked about, the different issues that we're having relative to health insurance, and I named them off in my testimony, it's providers, it's payment, it's the drug pricing chain, it's, all of the different factors that we talk about every day in the health committee that need to be examined to figure out what's working, what could be improved as we try to deliver healthcare to all Marylanders. So given that, can I have a motion on the amendments?
Move the amendments.
Okay, a second?
Second.
Okay. Any discussion on the amendments? Seeing none, those in favor of the amendments, please say aye.
Aye.
Any opposed? Okay, seeing none. Can I have a motion on the bill as amended?
Move the bill.
Okay,
Second.
and any discussion on the bill as amended? Seeing none, those in favor, please say aye. Any opposed? Delegate Kipke? Okay, that's up, that's
Raising.
up, opposition,
Yes, me too.
and okay. Morgan, okay.
Thank you.
Okay, the bill passes. Thank you all very much. We have about 7 minutes before we go into bill hearings, so thank you for your help today, and we will watch to see if we are going when we're going to meet again. Thank you all. Have a great afternoon. Okay. Yeah.